Hello everyone. In this video, I'm going to talk about mitral stenosis. It is a condition in which the heart's mitral valve is narrowed. This prevents the valve from opening properly and thereby blocking blood flow coming into the left ventricle from the left atrium, and henceforth leading to an increased risk of a variety of complications. Here we can see a narrowed mitral valve. This is how it's seen on longitudinal section, and this is how it's seen on transverse section. In this picture we can see the various parts of the mitral valve: the anterior and posterior leaflets, the anterolateral and the posterolateral commissures, the anterior and the posterior annulus, and here we can see the connection to the chordae tendineae and the papillary muscles. The major causes of mitral stenosis include rheumatic disease or valve calcification. Other causes may also include radiation, congenital, parachute, mitral valve, supravalvular mitral ring, systemic diseases, carcinoid, systemic lupus erythematosus SLE, rheumatoid arthritis, mucopolysaccharidosis, previous endocarditis, etc. The common symptoms observed in mitral stenosis include dyspnea and cough, orthopnea, and chest pain. Dyspnea and cough occurs due to pulmonary vascular congestion and pulmonary hypertension. Orthopnea, on the other hand, is related to positional increase in preload when assuming a supine position. And chest pain may be related to right ventricular hypertrophy and pulmonary hypertension. Other symptoms like hoarseness, peripheral edema, fatigue, and systemic thromboembolism may also occur. Here is a great picture which shows how the symptoms occur and the various complications which may also occur. Due to the stenosed mitral valve, there is decreased left ventricular filling. This leads to increased left atrial pressure, causing left atrial enlargement, and may precipitate formation of thrombi or atrial fibrillation. Development of back pressure can lead to pulmonary congestion and furthermore pulmonary hypertension, as the pulmonary vein drains into the left atrium. All this in turn leads to right ventricular pressure overload, followed by hypertrophy, and finally right ventricular failure may also ensue. The various clinical features of right ventricular failure may include hepatic congestion, increased jugular venous pressure, tricuspid regurgitation, or right atrial enlargement. So as you can see, a mitral stenosis can lead to profound and lethal complications. The normal valve area of the mitral valve is 4 to 6 centimeters square. Here is a table showing the various degrees of severity of mitral stenosis, from mild to very severe. This can be noted best on echocardiography. The more the gradient and the less the mitral valve area, the more dangerous it is. A gradient of more than 10 mm Hg and a mitral valve area of less than 1 centimeter square is considered to be very severe. The gradient refers to the difference of pressures in the left atrium versus the left ventricle. Here we can see the various peripheral signs which can be observed in mitral stenosis. Malar flush due to back pressure and buildup of carbon dioxide. Atrial fibrillation, which can be seen as an irregular pulse and loss of A wave in JVP. Left parasternal heave may be present due to right ventricular hypertrophy. A non-displaced tapping apex beat may be present, and a classic mid-diastolic rumbling murmur with pre-systolic accentuation will be heard after the opening snap. The murmur is best heard at the apical region and is not radiated. It is low-pitched and it is best heard with the help of the bell of the stethoscope. Its duration increases with worsening disease, and a thrill might be present when palpating at the apical region of the precordium. There are various investigations to confirm our diagnosis of mitral stenosis. ECG may show P mitral, that is a broad notched P wave in several or many leads with a prominent late negative component to the P wave in lead V1, and this may also be seen in mitral regurgitation. Doppler echocardiography is the gold standard in the evaluation of the severity of mitral stenosis. A chest X-ray may also show an enlarged atrium, which may elevate the left main bronchus by pushing it upwards. Lastly, the cardiac chamber catheterization is also a helpful measure, which is used for measuring the right and the left heart pressures. A characteristic feature found in mitral stenosis is the increase in the left atrial pressure compared to the left ventricular pressure during ventricular filling or diastole. Let's now talk about the management. Medical treatment like nitrovasodilators, beta blockers, or calcium channel blockers can be used to control angina. Various antihypertensives may be used to control hypertension. Also, nitrates, diuretics, digoxin, etc., can be used to control heart failure if present. Regarding surgical options, asymptomatic patients do not require any intervention. The indication for invasive treatment or surgery with either a mitral valve replacement or valvuloplasty is NYHA functional class 3 or 4 symptoms. NYHA classification is the New York Health Association classification used to determine the extent of heart failure. Another less invasive option is balloon dilatation. It is also advised to consider immediate valve surgery in cases where the mitral valve area is less than 1 centimeter square. With this, I would like to conclude this video. Hope you guys found it helpful. Thanks for watching and stay tuned for more.